Thanks, Jackie. No, it's all good. I wanted to know if the meeting was being recorded.
Okay, thank you. So I think we should start. Let me see what's the time now. Oh, it's actually 3 o'clock. Okay, so I think we can just start and hope that the people who haven't joined will be able to join us in the course of the discussion and the meeting. We are here. Maybe I just welcome everyone. Thank you for making time out of your Saturday afternoon, morning, or evening to be able to join us. We at the Network of African Science Academies are really honored to be able to host this side event alongside the Africa Climate Week for 2021. Our topic is developing and using the scientific evidence base for tackling challenges of climate change for human health. I have the honor and the pleasure to be your moderator for this session. So without any further ado, allow me to introduce my president, Professor Norbert Honkonu, who's speaking with us from Benin, to be able to give us a welcome and our introductory remarks into NASAC and IAP. Professor Honkonu, you have the floor.
Thank you, Jackie. Distinguished guests, Your Excellencies, fellow scientists, ladies and gentlemen, all other protocols observed. I'm honored to be part of this gathering under the United Nations Framework Convention on Climate Change, Africa Climate Week event banner. We take this opportunity to appreciate the event organizers and both IAP and NASAC secretariats who have worked tirelessly towards making this side event a reality this afternoon. Allow me to first elaborate the value of science academies and NASAC, the network of African science academies. An academy is an everlasting parliament of intellectuals of top level dedicated to the advancement of scientific knowledge within the institutions and on a global scale. For this reason, science academies must pursue scientific excellence and imbue independent merit-based processes and practices. Academies aspire to seek nationwide economic and social advancement through the application of science, technology, and innovation in a merit-based manner. In so doing, they ensure that through their membership and leadership, a strong public voice for scientific excellence and science-informed development is promoted. Academies empower curiosity, discovery, and innovation by stimulating national interest in STEM. Academies therefore promote and support research, seek to improve science education, disseminate scientific knowledge, as well as recognize and publicize scientific achievements and ethics. NASAC is the umbrella organization for 28 science academies in Africa, based in Nairobi, Kenya. NASAC's main mandate is to facilitate the creation of science academies in countries where none exist, and to strengthen existing academies so that they can fulfill their mandate as well. With regard to the first objective, NASAC relies heavily on eminent scientists within a country to spur the interest towards creating science academies. Once formally established, an open invitation is made for the new academies to apply for NASAC membership. The membership of NASAC remains relevant by influencing policy and engaging government on pertinent issues. NASAC member academies promote scientific excellence, science for science, translate research into practice, science for society, and offer science-informed advice to policymakers, science for policy. This value of science academies in the developmental landscape is significant, and their convening power makes it possible to rely different stakeholders to deliberate on pertinent social issues like climate change and health, for example. On the global stage, NASAC is the affiliated member of Inter-Academic Partnership, IAP for Africa. IAP is the global network of academies in science, engineering, and medicine. IAP currently has 140 member academies, comprising of 4 regional networks: NASAC in Africa, ASA in Asia, ASAC in Europe, and IANAS in Americas, and more than 3,000 leading scientists, health professionals, and engineers in over 100 countries. One of the strategic objectives of IAP is to empower academies and regional academic networks to provide independent, authoritative advice on global, regional, and national issues through synthesis reports, consensus statements, foresight studies, critiquing public policy processes and outputs, and convening case stakeholders. The Climate Change and Health Report, which will be the focus of this side event, is one such output providing science-informed advice. The first phase saw NASAC develop the Africa report through a panel of experts. In the second phase, NASAC will provide a synthesis in collaboration with other networks to develop the global report on climate change and health. The side event today enables us to communicate the major findings of the Africa report on climate change and health. We will be able to engage with some of our experts and contribute to enriching our final output. We therefore thank you so very much for making the time to join us this Sunday afternoon. We very much look forward to an insightful virtual deliberation. Thank you very much for your attention.
Thank you, Professor Nkono, for those insightful remarks into our network as well as IAP. And thank you everyone else who's joined us, found us in the process of going on with the proceedings. You're very much welcome. And we look forward to hearing from you because we hope it's going to be an engaging session as well. As I've indicated on the chat, please remember to put in your questions on the chat item because at the point when we are having plenary discussions, we might not be able to hear from everyone, but at least it will give us an opportunity to address the questions as they come, as you hear the speakers. Now, I'm the next person to speak. Please remember to always mute your microphone so that we don't run interference with the other presentations. So I'm going to talk about our process and how NASAC gets to be part and parcel of this great activity. The assignment was to produce the climate change and health report for Africa, but also to be able to contribute to the global report for which IAP is currently working on, still on the same topic, which is climate change for human health. When we got engaged into this activity, our aim was to produce a scientifically sound report, one that can stand when we're comparing world-class scientific documents in terms of its merit when it comes to generating accurate and world-class type of science. We also needed to use evidence, so the report itself had to be evidence-informed. The aim of the project was mainly to get the regional networks globally. So with IAP, as you heard from Professor Nkono at the beginning, is that it's a network of 4 regional networks, and collectively is what we term IAP, because then the academies that are affiliated to the networks are members of IAP. So within the framework of NASAC being the affiliate network for Africa, we as a network agreed to produce the Africa report, and you'll hear the highlights of the findings of that report from Dioraj when he speaks later on, and as well as during the panel discussions when we have highlights of various sections of the report as well. That session will be led by Claudia. Now, when we constituted the panel of experts that would be part and parcel of generating at least a well-coordinated, well-researched, and scientifically sound report. We went back to our science academies. As you heard, NASAC has 28 science academies in its membership. So we asked them to nominate experts that were both good in climate change activities, have been part and parcel of the IPCC process, or have been made other contributions on climate change. But because the topic include health, we also included health experts, and we went as far as including experts who are also dealing with nutrition, dealing with non-communicable diseases, because we needed a report to be both well-rounded and also sound in its specifics. So we identified through that process of having academies nominate experts to participate in the group. We had 24 experts being nominated, and they've been part and parcel of the working group from the onset. And they've enabled us to develop the report that we will be hearing about today. Now, as also mentioned by our president at the beginning, that our contribution as a network from the Africa report will also include the synthesis of that report in provision of a chapter and other sections of the global report on the same topic of climate change and health under the IAP banner. So we're able to second section, I think 3 of our experts to be part of the expert panel on the global report as well. I also say that during the process of developing the report, we had the honor and the privilege to also work with young scientists, especially the Global Young Academy membership, who are also part and parcel of the process, but also our link with ISAC through Robin and Claudia have also been immensely, have also immensely contributed to having a report that can speak to the items that other networks are speaking to. But at the end of it, and this is how I conclude, is why do we as a network or as IAP engage in the production of the reports that we are discussing today during this side event? One is because as scientists, we have to constantly be able to provide new knowledge. As you know, even in scientific writing, knowledge gets outdated. So sometimes when you have to have a cited document, it needs to be updated and well abreast with the current changes because life is dynamic. So we need our scientists to constantly provide that portal to enable us get new knowledge. But second is to provide an avenue that we're able to inform both policy and society on pertinent issues, because climate change and health is something that is really critical for our political leadership as well as the society at large. And especially now when we're looking at COVID, this has really been an issue, and we think that our reports will be able to contribute to inform and provide that evidence-based research that is required for that. But last and not least is, even from the African point of view, to be able to impact global science, because it is the information that we put forth that is able to rejuvenate, to be energized, and to give us new knowledge that can impact the world globally. So we, in as much as we act locally, we are able to produce information that can be replicated and can be utilized beyond just our borders. So our global impact is critical. So that is where I want to stop with my introduction and why we are engaged as a network, the Network of African Science Academy, which is an affiliate network for Africa for IAP, into this process. And with that, I think it would be nice now to hear from Andy, who will talk about, give us an overview of global solutions for health effects of climate change and other crises. Andy, you have the floor. Thank you.
Well, thank you very much, Jackie. It's a great honor and a pleasure for me to say a few words, share some insights about global solutions to climate change and health. I hope that you can hear me and see my slides clearly.
Yes, we can. Thank you.
So the first slide really tells us what we already know, which is that climate change is happening. It's due to the activities of humans. And you can see that the observed increase in temperature, now approaching 1.2 degrees on global average increase since pre-industrial times, is related to the emission of greenhouse gases from human activities. If we take into account natural factors, you can see there'll be no change in temperature. So it's now beyond doubt that we are heating up the atmosphere, and this will have big implications for human health, as shown on the right side of the slide. An infographic which summarizes the different pathways by which climate change can affect health. The direct effects, for example, of heat or extreme events, the disruptions to ecosystems affecting allergies, food, water, and vector-borne diseases. And of course, the effects through socioeconomic systems, increasing poverty, undernutrition, effects on work capacity, probably effects on conflict, and not just on physical health, but also on mental health as well. So these are wide-ranging impacts, and I'm not going to go into detail. They'll probably come out more in Dheeraj's presentation. I'm going to focus very briefly on the actions that we need to take. And there are two types of actions that we need to take in order to reduce the effects of climate change on human health, but also in doing so, we can improve health in the near term. One of these is adaptation. So we need to manage the risks of climate change impacts, reduce those risks through better disaster management, better flood protection, upgrading infrastructure, resilient food systems which can withstand climate shocks, improved education systems which can give much more information about the effects of climate and other environmental changes on human health, and water, sanitation, and of course, healthcare systems. And then we also need to mitigate, because adaptation will not be sufficient. And the more we mitigate, the easier it will be to adapt. But there will be limits to adaptation. We don't exactly know where those are, but there will be limits, physiological, technological, or behavioral, or economic. And once those limits are exceeded, then the effects will get worse much more quickly. Emissions. We need to cut greenhouse gas emissions very rapidly to achieve net zero emissions by 2050 at the very latest. And of course, it's the high emitting nations, the high income countries like my own, like many other industrialized countries, that have to take the lead on implementing these deep cuts in greenhouse gas emissions through clean energy, sustainable transportation, and a range of other actions through different sectors. Now, we do know that the evidence base for some of these interventions and actions is quite weak. Just one example at the bottom of this slide shows a recent systematic review of over 1,500 papers found only 2 studies evaluating climate change adaptation responses in relation to public health in low and middle income countries. So there is a lack of evidence, but that shouldn't stop us from taking action. We should take action, but evaluate it as rigorously as we can. And this just gives you one example of that. This is heat-related, how we can reduce heat-related health risks. It's taken from a very recent paper in The Lancet, just came out a few weeks ago. And you can see that what it does is to lay out in a diagrammatic form, in this case, how we can tackle heat-related problems within the health system. So the health sector needs to lead, but it can't do so alone. It needs to engage a whole range of other partners. It needs to develop better early warning systems and surveillance, using meteorological forecasts, for example, more effectively. It needs to have a community response plan with, say, cooling centers for the vulnerable, distribution of safe water, targeting a range of vulnerable groups shown in the right side of the slide. And this needs to result in climate resilient health systems that can withstand shocks, including heat waves. If we look at sustainable cooling strategies, these are at 3 different levels. The landscape, the urban level, for example, more green space in cities, which helps to cool cities and reduce the urban heat island. Buildings that don't rely just on air conditioning, because air conditioning depends on electricity and the grid can fail during heat waves. And if you use electricity powered by fossil fuels, you actually increase, of course, the climate change problem. So we need to have passive cooling where possible. And of course, there's a lot of individual actions that can be taken as well to keep well hydrated, to plant shading around our houses, external shuttering and so on to reduce the heat burden. So there's a lot that can be done to reduce heat effects. And indeed, one could also list similar kinds of interventions for a range of infectious diseases. This is water and sanitation, shows you a range of different strategies. The effects of climate change on precipitation, on rainfall, will vary according to region. So in some regions, we'll see increased intensity of rainfall. In some, we'll see decreased and they may be combined in some regions, maybe episodes of both. And very, very briefly, you can see that there are different strategies to enhance resilience in the water and sanitation sector. On the left, you can see, for example, where you have high intensity of rainfall, then you can use rainwater collection as a source of fresh water. But on the right, you can see that if you have a decreased rainfall or drought, then rainwater collection is very vulnerable to such changes in precipitation. You can use deep wells, of course, to draw up clean water, but there's a problem with that because in many parts of the world, the aquifers that supply these wells are being drained, and the aquifers cannot be replaced, cannot be replenished on a human lifespan of human societies. So there are big challenges in adapting the water and sanitation sector to the challenges of climate change. But let me move on from adaptation very quickly to talk also about mitigation. So what do we need to do in the short term to reach the Paris Agreement target of 1.5 degrees? And unfortunately, that target is really rapidly receding from our grasp, sadly. But we have to keep well under 2 degrees, that's for certain. So what are the most important short-term things that can be done? Renovation of buildings to make them more energy efficient, stopping building coal power plants. And I noticed the Chinese government just yesterday or the day before said it will not finance any further new coal plants, which is a good step forward. Stop selling fossil fuel powered cars, develop a zero carbon strategy for aviation and shipping, ensure that new industrial installations are also powered by renewables, stop deforesting the land, ensure that agriculture follows best practice, reducing methane emissions from livestock, rice paddies, and so on. Unfortunately, these actions are not being undertaken at the right speed and scale. So at the moment, we're heading for well over 2 degrees, possibly above 3, depending on the actions that we take. So how can we incentivize action? Well, one is by making the health co-benefits of greenhouse gas mitigation much more well known, much more prominent in the policy landscape. One of these benefits is when we stop burning fossil fuels, we stop obviously driving climate change, but we also benefit our health in the near term through reduced air pollution. We're all breathing in air pollution. Our health is suffering as a result of virtually the whole world's population, even those exposed to relatively low levels, because there's probably no safe level. And this slide just summarizes the benefits from reducing the burning of fossil fuels. This is just the benefits from cutting air pollution. We estimated about 3.5 million deaths, premature deaths every year, something of that order. The map shows you where those deaths are largest. You can see there aren't so many over Africa, and that's because Africa doesn't burn that many fossil fuels. Although, as I'll mention in a minute, there are other sources of pollution as well. But if Africa were to pursue a high carbon development strategy, and of course, those deaths from fossil fuel air pollution would increase. So big benefits for the climate and for human health from decarbonizing, moving to clean, renewable energy. But as I mentioned, there are other sources of pollutants. Some of those are climate active. We know that black carbon, this fine black particles that come from agricultural burning, shown on this slide, old diesel engines, cook stoves or open fires, from waste burning from brick kilns, artisanal brick kilns, and also methane produced from rice paddies, from animals, from ruminants, and from wastewater. These all contribute to air pollution. Methane is an ozone precursor, and ozone, it kills probably about 1 million people a year, something of that order. Black carbon is also a powerful air pollutant. So if we phase out some of these short-lived climate pollutants through clean energy and other strategies, we can also benefit health. This estimate, 2.4 million premature deaths a year, avoiding much climate warming and also benefiting crop yields as well, avoiding crop losses from some of this pollutants. You can't just add the two together from fossil fuels and these strategies because they do overlap somewhat, but it gives you an idea of the big benefits that could accrue from mitigation. A lot can be done in cities. Cities are responsible for about 3/4 of greenhouse gas emissions, something of that order. A recent report has shown us that those city leaders that emphasize the co-benefits of climate action are more likely to take really active and deep cuts in emissions than those that don't emphasize the benefits. This is a survey that was done by CDP and ICLE of over 860 cities around the world, including some in Africa. There's a lot that can be done: clean energy, clean transport, more public transport, more walking and cycling where it's safe to do so. And of course, more green space in cities as well. Green space is good for mental and physical health, also helps to reduce the urban heat island effect. So there's quite a lot that can be done within cities to reduce greenhouse gas emissions. We're also understanding that so-called nature-based solutions can provide substantial proportion of greenhouse gas mitigation by taking up carbon into intact ecosystems. So by preventing deforestation or restoring forests, we can take up carbon dioxide from the atmosphere, but also improve health, as shown on this slide, a study in the Brazilian Amazon, reduced air pollution, less fossil fuel burning, cleaner water, and reduced ecosystems can also lock in carbon and improve health. Finally, some of these farmer-managed natural regeneration strategies, we believe, can also help us to adapt to climate change, reduce emissions, take up carbon, and improve health if they're well designed. We also need to optimize the use of biomass because there's a limited amount of biomass in the world. We have a growing world population, and biomass is used for food, feed, and fuel. And sometimes these uses may come into conflict. So if you have lots of biofuels, for example, if rich countries start to plant lots of crops in order to grow biofuels, that could in some circumstances compete with food. Sorry, someone needs to turn off their mic, I think. So we need to optimize this use of biofuels or biomass in order to sustain human health, prioritizing food production, healthy food production, fruit, vegetables, nuts and seeds that are essential components of a healthy diet, as well as ensuring that we have universal access to to healthy diets. And then in concluding, let me just mention the importance of the healthcare system. So we're now increasingly recognizing that the healthcare system is a major contributor to greenhouse gas emissions. So if the global healthcare sector was a country, it would be the 5th largest emitter on the planet. So where do these emissions come from? Well, of course, high-income countries have much higher greenhouse gas emissions from their healthcare systems than low-income countries. They consume more resources, they consume more energy, and so on. And there are 3 scopes of emissions. I don't have time to go into detail, but they're summarized on the right side of this slide. The direct emissions, scope 1, from burning fuels on the sites of hospitals and other healthcare facilities. The indirect emissions, scope 2, from electricity, and scope 3 from medical devices, freight, transport, pharmaceuticals, all of which have large amounts of embodied carbon because they're very energy intensive. So increasingly, healthcare systems will need to become net zero resilient healthcare systems. And indeed, NHS England has now committed to the reduction of net zero by 2045, even for indirect emissions, working with pharmaceutical and other industries to reduce their footprint. So there's a lot that can be done. So finally, in conclusion, what can we do to enhance the protection and the improvement of health through adaptation and mitigation of climate change? And there are a number of different pathways. One is through the so-called nationally determined contributions. These are the contributions that every country makes under the Paris Agreement, Paris Climate Agreement, where they agree to adapt to climate change and also to mitigate emissions. Historically, these have rarely mentioned health, but they are increasingly mentioning the health benefits, although often not quantifying them. So we need to accelerate the ambition and inclusion of health in these nationally determined contributions. National adaptation plans often make little reference to health, on human health. Climate finance often doesn't include health, doesn't pay due recognition to the importance of protecting and improving health through climate adaptation and mitigation. And we need to accelerate the level of climate financing that's going to protect health. There's a lot of work going on, including through WHO, through the Aga Khan Foundation in a number of low middle income countries to create net zero emission resilient health systems. And this is a very fruitful area of development in the future. We're seeing an increased amount of litigation, climate litigation, to try and force governments to take more rapid action. And the health argument of protecting human health is going to be a very important argument, working with our legal colleagues to try to accelerate action. And finally, we are seeing a lot of action at the subnational level. We see a number of visionary city leaders. They seem to be able to take more action than many national leaders. They're closer to the people. They know what kind of policies to put in place. And so the healthcare and the public health community need to work with these subnational leaders to help them to implement policies to adapt to and to mitigate climate change in order to protect health, our health, and the health of future generations. Thank you very much.
Thank you very much, Andy, for that insightful presentation. And thank you also for giving us the global perspective. Now we want to hear from Dheeraj, who will give us the key findings from the NASAC working group on climate change and health. Dheeraj, you have the floor.
Thank you. Can you all hear me?
Yes, we can.
Very good afternoon to all of you, and I thank the previous speakers. They have made my job a lot easier also. My focus will be to present, as Jackie mentioned, and Professor Sokhna mentioned, that we are working on this climate change and health. In particular, we're looking at focus on Africa. So I'm going to share what we have found in our report. Some of the report is still being pretty much analyzed, but some is still being reviewed now. As we know, we are interconnected in this world by the air we breathe, the water we drink, and the food we eat. And all of these elements, the ecosystem, are affected by climate change. Therefore, in the end, we are all connected. What happens globally is of interest to what happens in Africa. And what happens in Africa is of interest to the global community. In doing so, we search for what evidence exists for climate change in Africa and what is driving it, and then come up with some solution where that can be practical, some of which already been approached. Why we are so vulnerable in Africa? We are vulnerable for many reasons. First of all, we know we are disproportionately affected by the negative impact of climate change. We produce the least amount of greenhouse gases, and we bear the biggest brunt of the negative impact of climate change. The reason being because we are at least, I can share with you at least 5 different vulnerabilities. Is the topology and physical features of the continent, the population demography, the non-resident health system, the high prevalence of climatic hazards, and the high prevalence of climate-sensitive diseases. The topology, as you know, Africa spans both equatorial and tropical latitude, including coastal region, and 60% of our land mass is dry land, and we have about 30% of which is desert. The population live mostly 50% in arid, semi-arid region, and most exposed are the women, the children, and the elderly, and those working in outdoors. We have low adaptive capacity because we have poor infrastructure to cope with the climate change. Our health system did not cope with increased disease burden and the normal circumstances like epidemics and pandemics. And now we get overloading the health system with the burden of climate change, disease resulting from climate change. Due to our topology, I explained to you, we have a high prevalence of climatic hazards, extreme weather, flood, drought, heat, and others. And we already have a pre-existing level of climate-sensitive diseases like zoonotic, vector-borne, foodborne, that are going to be amplified by the climate change effect. How much will it amplify? What do we have? Let's see, what do we have? Well, the highest death due to climate change is predicted to be in Africa. WHO did a disease burden estimate in the year 2000, but it's still valid. You can see the African continent is the one that is most going to be affected by death due to climate change. And you can even see within that Africa, it's not proportional everywhere. And that reflects the vulnerability, the topological, the geographical, the socio-demographic, and all the factors that I mentioned to you about. For instance, for the period of 2000 to 2019, we had 25,000 deaths. And we similarly, drought affects equal number of people, close to 362 million people affected. And flood, Then we have I mentioned to you, foodborne disease. We have increased risk of non-communicable disease, and migration due to climate change put another stress on us. Close that view. Okay, never mind. I have chosen as an example multiple. I've chosen as example food security to show how the different different climatic hazards are interrelated, and how the health effect then become interrelated. Now, I've chosen food security because of 60% of the food supply is locally produced, and the remaining is based on import or on donation. Let's look at the triple effect of drought, flood, and pest. As Professor Haynes mentioned, we live in an ecosystem where we are interrelated, and we have direct and indirect effect. Well, the most direct effect of heat, drought, and flood combined with pests lead to crop failure. And indirectly, the flood contaminates the ecosystem, the water that we drink, the food that we eat, and that also leads to have some effect. Now, the reduced food, the crop failure lead to reduced food security and increased food insecurity that will enhance the malnutrition that already exists. And then we are forced to import food that is energy dense, or grow food, the biocrop that against energy dense. And the net effect of all of this, it leads to loss of life and livelihood, and it exacerbates the poverty that exists, and it puts us at increased risk for non-communicable disease, particularly when combined with the stroke due to heat. We get an increase in cardiovascular stroke. And of course, indirectly, again, is going to affect us with malnutrition. So you can see how the hazard interplay with each other to impact one condition. And when one health effect is impacted, it has a spillover effect in other sectors. And this multiple interaction pathway is observed for the climate-sensitive diseases like vector-borne, malaria, dengue, malaria mouse, Rift Valley fever, Zika, and all the rest. And zoonotic disease that are coming like Ebola and other epidemic-prone diseases. So what can we do? This is, by and large, what we find, the theme that runs through. What can we do? Can we find some equitable solution and some co-benefits? Well, one of the things we find, the biggest one, is gap in the database. We don't have country-specific data on the prevalence of climatic hazard in time and space. And worst of all, we don't have the same database for disease mortality linked with exposure. So in absence of these, we do not have solid evidence to prove to the policymakers. In absence of evidence, policy is formulated in the way that is most suitable to the politician or to the policymakers. So we need to really buckle that gap of having a linkage between the hazard and the health and country-specific data. Most of the data we got was derived from elsewhere or from extrapolation. Also, we need to adapt a public health package. Professor Haynes already mentioned the nationally determined contribution and the national adaptation plan. We really need to really strengthen that. Many countries in Africa have a national adaptation plan, but very few mention health explicitly. And that is one that have to link. That's because most of the adaptation plan has been formulated in the Ministry of Environment and usually is in isolation with the Ministry of Health, with little intersectoral collaboration. We need to mitigate through alternative technologies. We have to empower the local communities to adapt and mitigate. For instance, planting fire-resistant trees, changing lifestyle, our diet, from high protein to low protein to vegetable-based to insect protein. And there are a host of others that are indigenous technologies that the people have been using for years. We have to observe and use and exploit those. and Professor Haynes mentioned many, that we have to find how we can incorporate them on our continent. We have to influence the policy in the formulation process. That means we have to include health in all policy for inter-sectoral collaboration, because most of the big projects are done outside the Ministry of Health, like environment, energy, and that impacts the health. So every project that we do must have a health impact assessment. And we have to influence by advocacy through the regional, national, or local level. Professor Haynes also mentioned that there were only 2 papers looking at adaptation in low-income countries. There really is a dearth of local publication in Africa. Sadly enough, we have collaboration, but that often leads to a publication that may or may not be of value to us, and that stands alone by itself. So we really need to partner with established scientists and institutions so we can build our collaborative research. Climate change is not going to be solved within the boundaries of a nation or a continent or a region. It's a global problem. It requires a global effort. And in that respect, we really have to have a global collaboration. Where do we stand? Well, we face with 2 solutions: mitigation and adaptation. Both have health effect in different time frame. Now, the COVID-19 pandemic has wreaked havoc on our economies and our health system. But it also creates an opportunity to introduce, implement, and sustain green technologies. Africa produces the least greenhouse gases, and we yet bear the biggest brunt from the climate change. Now, the question then arises, legitimate question, should Africa then focus only on health adaptation, or should we also look at health adaptation and mitigation? Naturally, we should focus on both, because to have immediate and long-term effect. But to do so requires substantial commitment, financial, infrastructure, manpower, technology to be transferred and sustained and maintained in the local environment. So we have the solution, but we have to partner, and it's a global problem. It depends on the global community resolving that problem. I thank you all for your attention, in particular to my collaborators who work together on this project, some of whom will have the opportunity to speak very soon and share that I couldn't do justice to present all the work, and to the sponsor. I'm going to stop in here.
Thank you. Thank you, Dheeraj. I think the next session now will be led by Claudia, where we hear from the discussants, and then we transition quickly into the plenary. We have just 15 minutes left, so we try and shorten the discussion points. Thank you very much. Claudia, over to you.
Thank you, Jackie. Good afternoon. So it's my pleasure to introduce the next 3 discussants. The first is Robin Thiam, who's Biosciences Program Director for ISAC, and also has been consulting for IAP and is a member of the Climate Change and Health Project. We then also hear from Caradee Wright, a senior specialist scientist at the South African Medical Research Council, leading the Climate and Health Research Program in South Africa, who's also contributed to the report. And finally, Dr. Sokhna Thiam, a researcher at the African Population and Health Research Center in Dakar, and also a health geographer, epidemiologist at the Swiss Tropical and Public Health Institute. And over to you. Sorry, this was fast. It's just we're running a little bit late.
Okay, thank you, Claudia. Thank you very much to the organisers for inviting me as a discussant. I have 3 minutes, so I will try and cover a couple of points quite quickly. As you've already heard at the beginning of this session, this wide-ranging work by African scientists is part of a global project, and we anticipate that our global project, inclusive, interregional and transdisciplinary, will be very relevant in the run-up to COP26 in a couple of months' time, and perhaps even more, COP27, which will be hosted by Africa next year. But the regional work is very important in contributing to a global report, as you heard. And a global report partly has the function to focus on those issues that can best be addressed at a global level with global critical mass. I think we can all agree that the mitigation of climate change is a global public good, but so is coordinated, inclusive and diverse research. And I support the point made by Dheeraj just now about the importance of collaboration across the world. Now our project design also encourages each region to share examples, good practice within the region, to bring key issues to the attention of the other regions and to a global audience. And I just want to spend the next 2 minutes giving 3 examples from the work of the African countries that have relevance worldwide. First, one of the case studies in the NASAC report is from the Côte d'Ivoire on greening strategies in urban planning. Provides a lot of detail on the city level, emphasized a key priority both by Andy and Dheeraj. And in focusing on urban planning, that the Côte d'Ivoire case study emphasizes the importance of taking into account local socio-economic factors. Cities aren't homogeneous, and of course we all know, cities aren't homogeneous in terms of their populations, and it's crucial to focus on those who may be most vulnerable to the impacts of climate change in the urban environment. And that includes understanding determinants of socioeconomic status. Secondly, the NASAC report highlights the opportunity to adopt innovative energy technologies. Dheeraj just mentioned this, part of mitigation. That is to avoid the historical lock-in experienced by other countries to previous generation technologies based on fossil fuels or biomass. Easier said than done, of course, but it can bring increasing competitiveness for those countries making these choices and developing new industries. And as Dheeraj mentioned just now, the green transformation must also be part of the sustainable economic recovery that we all desire after COVID. And there's actually a good example of collaboration cited in the NASAC report in this area between Africa and the EU, the Green African Transformation. And that will be important to all of regions. And thirdly, and finally, many of the issues cross national borders. We've heard about it, infectious diseases and air pollution. One example that derives from some of the other work within this global project in the Mediterranean region, of course, covers countries in North Africa as well as elsewhere in the Mediterranean, describes how a number of the countries in North Africa are becoming vulnerable to the infectious diseases spread by arboviruses, such as dengue and chikungunya, from neighboring countries in the Mediterranean, including some in South Europe. And countries in North Africa are also susceptible to the spread of new strains of disease vectors from the Arabian Peninsula and further east. And this is the general point that I'll finish with. We do need coordinated approaches between countries, both in disease surveillance and in responding to diseases and preparing for the future. We need this coordination, and we also need it for climate justice. And Andy finished with one of the issues for legal systems, climate justice in pursuit of health and health equity for all. So I'll finish there. Thank you.
Thank you, Robin. So if I could invite now Caradee to give a contribution, please.
Thank you. And I know we're short on time, so I'll speak very briefly. Thank you for the opportunity to be part of what's been an incredible 49 minutes so far. I was asked to touch on the use of different types of stoves and how they can improve household or indoor air pollution. So I'm going to just give 2 examples. First of all, some work in South Africa that I'm aware of, where there have been studies that look at the change from solid burning of fossil fuels in homes to stoves that are non-solid fuel burning. And there have been some really impressive measurements made that show a reduction in the concentrations of PM2.5, for example, and that can often be in conjunction with other measures of intervention, for example, insulation and the presence of a ceiling, in fact. But what's more important in those studies is also trying to get behavioral aspects and traditional and cultural aspects into the intervention itself. Some very impressive work which is happening in Ghana in a study which is called GRAPHS, the Ghana Randomized Air Pollution and Health Study. And here they've looked at fan-assisted efficient biomass burning cook stoves as well as LPG stoves. And they've looked at pregnant mums and concentrations of CO2, PM2.5. And they have seen some very impressive results, particularly in a reduction of CO2 over 48 hours of up to 47% in their LPG arm, for example, and a reduction of 32% of the PM2.5 concentrations in the LPG arm, lower than the control arms. Now, these kinds of studies are critical, and as Professor Dheeraj was saying earlier, there is a dearth of literature on the African continent. We do need to work together to make quality epidemiological studies. We don't have the luxury of just doing cross-sectional baseline work nowadays. We really do need to move forward into intervention-based studies using the highest standard of work that we can. And finally, the point that the WHO makes with response to indoor air pollution is that we need well-designed, implemented, and monitored stove interventions so that we can show the positive effects not only on exposure, but more specifically on the health outcomes. It's unlikely that even with any stove, we're going to see reductions below what we have just seen newly released, the World Health Organization Ambient Air Quality Guidelines 2021. But we can work with people to try and improve behavioral change, even though we know that this is still a challenge. But only with that knowledge will we be able to understand the barriers and the facilitators to ensure clean air inside homes, which also contributes to the ambient air pollution that was spoken about earlier. Thank you.
Sorry, I'm muted. Thank you very much, Caradee. So, Sokhna, if you would like to take the floor, please. Thank you.
Thank you, Claudia. Thank you, everyone. Thank you for the organizer for giving me this opportunity to be part of this panel today. I'm going to first to say that I'm a fellow alumna of the LIRA program. She's a leading integrated research for Agenda 2030, and I'm part of this report, NASAC report I contributed. I'm going to talk a bit about the issue of water and foodborne diseases, which is among the primary health impact of climate change, and which is also projected to become important public health issues. I just go the same thing like Dorothy said, with this research gap and data gap in Africa, which our research is for trying to fit, and we are trying to do transdisciplinary research on the area of climate change and health in Senegal and in Cote d'Ivoire. And maybe I will argue just some funding from this research we are doing. And what I say first is that scientific community, and in particular young researcher, has important role in generating new knowledge and countering misinformation on the health impact of climate change, on factor increasing vulnerability, and on the effectiveness of adaptation and mitigation strategy in close collaboration with policymakers. And this is what our research is for. Currently, we are working on 2 projects, as I said, in Cote d'Ivoire and in Senegal. And this transdisciplinary research aims to predict fit barrier risk in this area, and also to using different climate scenario, and also to sensitize and provide evidence best for policymakers to go ahead to better planning for intervention to mitigate and adapt this climate risk. What we did for this research is we did a time series analysis using data from long-term data from climate data from 1960 to 2018 and monthly diarrheal disease data also from 2010 to 2018. First, we look for trend analysis to first better understand the local climate, which is very important. Understanding the local climate can help better to know how we can process for intervention to face this climate risk. What the result of this climate trend show is that climate in Senegal first is characterizing by high variability, and we observe it an increasing and trend in the average and maximum and minimum temperature, which is key for this diarrheal disease. But temperature is one of the parameters that are much more exposed in relation to this disease. And we also look for did a regression model to see the association with the diarrhea risk and temperature and rainfall in this area. What I say is now just that we really need to have there is a really need for improving funding and for also maybe invest more for opportunity and training flow shoot, mainly for young researchers to go to if we want really to face climate change and help for adaptation and mitigation and also resilience for the health systems and the community, we really need to invest more for research to feel that because there is a need for data at all levels, regional, national, and local level, and we really don't have enough data for, I don't know, for discussing with these policymakers. And for this research we are doing, we really use local data and understand better the local climate and try to discuss with policymakers. The funding of this research I'm talking now will be presented to decision makers in Senegal here in the city official for during a knowledge sharing workshop, which is planning next week. And we hope that this result can help better to plan and try to reinforce health system, climate resilient health system, and community resilience and adaptation. I think I will stop now here and yeah, maybe continue for the discussion because we really don't have enough time to present the funding of this. No. Thank you to all.
Thank you very much, Sokhna, and I apologize I have not had time to give the discussants enough credit. So we have 2 minutes left. So what I would propose is I just read one of the questions posted in the chat window and maybe somebody could very briefly address it. So this is from Jashwant Brahma. To what extent are African governments willing to draw on research to develop policies to mitigate the risks brought due to climate change, and also to listen to those researchers for trying new policies? It's a large question, but if anyone has some thoughts or an example.
Would Dr. Caradee like to go?
I was going to say that my experience with my own country is, despite there perhaps being evidence that there is an effect, a positive effect of an intervention in another country, usually my country wants to see its own evidence locally. This is an enormous challenge for us because of the cost, for example. They may not wish to fund the interventions themselves. So we're using the available evidence we have. But then when we say, oh, but this comes from China, or even this comes from a country in East Africa, they say, but that's not local evidence. So at least from my experience, that's as much as I can say as to how much my government is willing to place their trust in other countries' findings.
Thank you. So I think now, since we're on the last minute, I will hand over to Jackie. Thank you.
Thanks, Claudia. And it's true, we really don't have much time. So open up the floor for my president to give the closing remark, but I just wish to acknowledge the presence of Professor Ngaira, who's a member also of our working group. Professor Josephine Ngaira, thank you so much for joining us. I've also noted with appreciation the participation of our newly established Academies members. So thank you so much for joining us as well. Professor Honkonu, you have the floor for the closing remarks.
Thank you, Jackie. I'd like to thank everyone for insightful aspects you raised to enrich our discussion. And all this confirm that we right to schedule such a side event. So we highlight the necessity of integrating mitigation and adaptation to protect and improve health, the necessity of health impacts of climate change, which are interlinked, necessity of sharing good practices, and the necessity of including impact assessment in all projects we do. And I think we all these convinced that climate change is a global concern and needs global approach, global collaboration with some coordination. So I would like to thank IAP for all this network support to NASAC, and thank you, every one of you, for sharing your experience, for sharing your points at these side events. So thank you very much and goodbye.
Thank you very much, Prof. And thank you everyone for joining us. Please remember to join the Africa Climate Week platform to be able to participate in other side events as well. We have a total week, complete week of other events too, but you have to register to be able to join them as well. So I want to stop there and appreciate everyone who participated today and gave off their Sunday afternoon. We will be reachable also. We are available on our social platform as well as through our website. You can get links to contact us. And any other questions you have of the report and the process or the content will also be availed to you when you reach out to us. So thank you very much. Do have a lovely afternoon or morning or the rest of your day. And we really, truly appreciate your support for participating. Bye-bye. Have a good evening.
Bye-bye. Thank you, Jackie.